Nigeria seems to be counting down to being Ebola-free. No new confirmed case recorded so far, and the treatment centers in Lagos and Port Harcourt have no patients, although some people are still under surveillance. While everyone continues to observe personal and environmental hygiene, especially regular hand washing with soap and water, another issue of concern is female circumcision, also known as female genital mutilation, which is practiced in many societies in Nigeria and other parts of the world. We'll be looking into these and other stories on the program. Although the Ebola virus seems to have been successfully curtailed in Nigeria, awareness campaigns still continue. Let's see this and other reports on our news segment. This gathering is to further boost the knowledge of members of the public on how to protect themselves against the Ebola virus. A number of movie makers here have joined forces with civil rights activists and other members of the public to tell everyone to continue to remain cautious as West Africa battles the EVD.
When you shake hands with people, use sanitizer. When you get home in the evening, have a bath. Tell people, advise your children. When your children are going out, tell them to beware who they touch, what they do. If they touch people, they should wash their hands. If people are sick, you should, and you think they have symptoms of Ebola, I know them, not them inside. If you are treating them on your own, you are opening yourself up and your family to the risk of catching it. If you are sick, that is not the time to say, let me go and die in my village. You are taking Ebola to the village. If you are sick, go to a quarantine area, and it has been shown that people who go to that area come back alive. All you need to do is save yourself. This is not the time when you should say, if I'm okay, then nothing concerns me. If your neighbor is not okay, you are not okay. If your landlord is not okay, you are not okay. If your landlady has Ebola, report them. If your husband has Ebola, report him. If your girlfriend has Ebola, report her. Everything, we should put it into practice. Putting on t-shirt, shouting, yes, it's not enough to make Ebola away. If you put everything into consequences and you use it well, that is when we are taking Ebola away.
But how well has the Nigerian government handled the Ebola threat?
Whether they have done enough or not, nobody can ever do enough. It's a continuous exercise. We must all continue to have it behind our mind that Ebola is real and it can always sneak in anytime. So as much as possible, we should all adhere strictly to all the conditions, all the precautions given to us by the medical, the health workers, so that we can be safe from Ebola.
We want people to be aware. A lot of people think Ebola is spiritual, and they wear ring, they do all sorts of things. It is not spiritual, it's a virus. And by the time people get this virus, they infect others. And it's not that you love somebody, then if the person has symptoms, you will run away from it. Or that we love our parents or anybody. If the person dies, you quickly go and bury the person. No, we risk disaster. So the essence is for proper sensitization. The essence is for proper awareness. The essence of this Ebola awareness is to ensure that all of us contribute the quota that we can in order for us to curtail Ebola. Ebola is real. We have to beware and we do not have to spread it. And we must do all we can in ensuring that we carry the message to the nook and crannies of this country.
Still on the EVD, an East African Nations Ministerial Conference in Nairobi, Kenya, has looked at joint efforts for preparedness against the virus. The two-day regional meeting was attended by ministers in charge of transport, health, immigration, and East Africa Community Affairs from Burundi, Rwanda, Kenya, Tanzania, Uganda, the Democratic Republic of Congo, South Sudan, and Ethiopia. Delegates from the organization's Intergovernmental Authority Development, World Health Organization, and African Union also attended the meeting. According to a regional advisor to the World Health Organization, 6 months into the worst Ebola outbreak in history, only 2 African nations are adequately prepared to handle the potential arrival of the virus.
Algeria and Ethiopia, that can be, based on what they reported, that can be termed like they are fully prepared to handle the Ebola outbreak. We do have 19 countries that are partially prepared, which means some work needs to be done.
The Ebola virus has caused much havoc in West Africa, but the WHO believes the worst is yet to come. Over 2,400 people have died out of about 5,000 confirmed cases. Meanwhile, Ivory Coast, the world's top cocoa producer and French-speaking West African country, has mounted one of the region's most robust efforts to fend off the Ebola virus. An epidemiologist in charge of Ivory Coast prevention against Ebola, Dr. Coulibaly, is working to ensure that the virus does not get on the Ivorian soil. Hand washing stations with buckets of bleach solution have appeared at the entrances of government buildings and office towers. Handshakes and the country's traditional greeting of 3 kisses on the cheeks have largely been abandoned on the advice of the government, replaced in some cases by a soft elbow bump. Although the country is yet to register a single case, at least 2 international conferences due to take place in Ivory Coast were cancelled. The potential dangers go far beyond the risk of a tarnished image. While economists are still assessing the impact of Ebola, it's increasingly clear that a major economic catastrophe is brewing just across Ivory Coast borders. Finally, from the news corner, the unprecedented Ebola outbreak in West Africa requires a $1 billion response to keep it spread within the tens of thousands of cases, and that's going by the words of a United Nations official. UN Emergency Coordinator Valerie Amos spoke to journalists in Geneva of the urgency of preventing the complete collapse of the health systems in affected countries, ensuring the availability of food supplies and supporting water and sanitation services.
First, we must prevent the complete collapse of health systems in the affected countries. Already, it's estimated that more people have died from secondary aspects, for example, malaria, tuberculosis, or in childbirth, or from chronic illnesses, than have died from Ebola. Secondly, the food security situation in some parts of the most affected countries is of great concern. The economic slowdown, disruption to markets, and imposition of quarantine, including roadblocks in some areas, are reducing the availability of food and the purchasing power of households. And remember, these are some of the poorest countries in the world. Third, support for water and sanitation services will be critical, as the recent heavy rains have increased the risk of waterborne diseases, and communities in quarantined areas will continue to have basic needs.
The World Health Organization's Assistant Director General, Bruce Aylward, underlined the need for a rapid action now. He said the WHO's previous forecast that the number of cases could reach 20,000 no longer seemed a lot, but the number could be kept within the tens of thousands with a much faster response.
This health crisis we face is unparalleled in modern times. The gravity of the situation is difficult to get across with just a few numbers, but with 5,000 now infected, twice the number when we met a couple of weeks ago, over 2,500 dead, nearly twice the number of when we met a couple of weeks ago, you start to get a sense of the rapid escalation now we're seeing of the virus as it moves from what was a linear increase in cases to now almost an exponential increase in cases.
UN Secretary General Ban Ki-moon has launched a global response coalition in New York. Senior UN coordinator for Ebola, Dr. David Nabarro, explains the need.
We are going to establish a global Ebola response coalition, which will be there to support and back up one of the biggest ever international support operations that's ever been known, because we're going to get on top of this virus as quick as we possibly can.
The United States had announced that it would send 3,000 troops to help tackle the Ebola outbreak as part of a ramped-up response, including a major deployment in Liberia, the country where the epidemic is spiraling fastest out of control.